Hi friends, today we are going to start speaking about urinary tract infection. Now, this is part of our clinical medicine series. If you guys like these videos, they help you learn, they make learning easier. Please help us by subscribing, hitting your like buttons, and if you love illustrations and notes, you'll go back to our subscription links and you get all these resources there. So let's dive right into urinary tract infections. So we're going to start learning about the types of urinary tract infections. Here we're going to talk about based on anatomy. We will later on speak about whether it's complicated or uncomplicated urinary tract infections. But to start with, we are going to speak about the upper urinary tract infections and the lower urinary tract infections. So when we talk about upper urinary tract infections, here we will be speaking about the inflammation of the renal parenchyma. And here we will be basically talking about pyelonephritis. Again, pyelonephritis is the inflammation of the renal parenchyma. That is for upper urinary tract infections. For lower urinary tract infections, we will be speaking about the inflammation of the bladder wall. And here we will be talking about cystitis. Now, to be discussed later on in another series of videos, especially in sexually transmitted infections, we will categorically also speak about the inflammation of the urethra. And here we will be talking about urethritis. Again, we will later also speak about the inflammation of the prostate, and that is called prostatitis. Okay, so but these ones are to be discussed in STI's series of videos. Now, what basically happens is you have an infection. We will zoom in right from our renal parenchyma and the walls of our urinary bladder, and we realize that there is bugs, bacteria, more common on the gram negatives than the gram positives that infect the renal parenchyma and at the same time infects what is termed as the bladder, the urinary bladder, that is the bladder wall. Now, in this context, we will be talking about these common bacteria that attack the two areas that we've talked about. Now, I have a good mnemonic for you. So, sick PP. Now, top on the list is Staphylococcus saprophyticus. Now, Staphylococcus saprophyticus is a type of bacteria that is common, especially status post sex. We term it as honeymoon cystitis. So, this is the second most common, actually. The first and most common type of bacteria that causes these infections is E. coli, that is Escherichia coli. The most common, that is the most common type of bacteria that gets up to 90% of these infections. And then another infection is Enterococcus faecalis. This one is not as common, but it's common in areas of nosocomials. That is, maybe there's a catheter in situ in hospital or any urologic procedures. The third most common type of a bacteria that causes these infections is Klebsiella. Okay, and we will also have another one that is Proteus mirabilis for P. This one is just like this Escherichia coli, Enterococcus faecalis. Now, but it's clinically significant because it forms what is called urease, and this urease, it has an enzyme known as urease, And these urease tends to break down urea into things like ammonia. Now that increases what's called low the pH, and increases the risk of what is known as the stones, that is the struvite stones. The last one is Pseudomonas aeruginosa. This is common in nosocomial environments, either catheterization or urologic procedures. So, mnemonic, sick, PP. So, Staphylococcus saprophyticus, you say that is common, status post sex. Most common in the exams, you'll find it as honeymoon cystitis. And then we have Escherichia coli, that's most common, that forms around 90% of these infections. We also have another one that is Enterococcus fecalis. This is common in nosocomial environments, whether there's a catheter in situ, in hospital environments, and you have a urologic procedure. Another one is Klebsiella, and then the next is Proteus mirabilis. Now, this is clinically significant, as you've said, because it has what it terms as a urease that breaks down urea, okay, into things like ammonia. Now, these ones increases the risk of a formation of struvite stones. Then we have Pseudomonas aeruginosa, that is common in areas of hospitals, urologic procedures, and as you also said, on whether we have catheters in situ. Now, the most common, first, before we even proceed to that, I want you to know that of all these CPP bugs, the gram-positive ones are Staphylococcus saprophyticus. We can technically add in the Staphylococcus aureus, but the most pronounced one here is Staphylococcus saprophyticus and Enterococci fecalis. Now, the rest, that is E. coli, Klebsiella, Proteus mirabilis, and Pseudomonas, are gram negatives. And that is important because we're going to talk about them when it comes to the pathophysiology and the diagnosis part of it. Now, how does this bacteria ascend? How do you get infected? Now, the most common one is when it goes up the ureter, right? And another one when they go up what is known as the urethra. They ascend. So there is ureteric ascension, and there is also what is termed as the urethral ascension. So it goes up and attacks the bladder wall and goes up and attacks what is termed as the renal parenchyma. There is a less common type of spread, that is hematogenously from our body into the renal parenchyma or otherwise, but that is less common, very less common. Now, another aspect that I want us to speak about are now the risk factors. Now, these ones are going to tip us into the other subcategories, that is either uncomplicated urinary tract infections or complicated urinary tract infections. Now, here we're going to talk about some risk factors. The first one is what is termed as anatomy and proximity. Now, first, this is very common in females, okay? Why? Because they have a short urethra, and you can imagine um, the proximity between the rectum, that is the anus, and the urethra. Now, that means it can spread easily from our rectum, that is the anal area, into the urethra, leaving alone the fact that the urethra in females is also very short anatomically. Another aspect that is less common, and this one tips us into the uncomplicated one, is sexual intercourse. These two are not as they are common, but do not tip us into what is termed as uncomplicated urinary tract infection. The other risk factors are structural and functional categories. Here, we'll be speaking about an obstruction and a dysfunction. Now, these two plus one other one are going to be tipping us into what is termed as complicated urinary tract infections. The first one is a male. So, can you imagine if we have an obstruction somewhere, and like in benign prostate hyperplasia. Now, if you have this prostate enlarged right down there and pinching down our urethra, that means we're not going to be passing urine. Okay, as a risk factor, very common in males, and that tips us, gets us into what is termed as urinary tract infection. The second one, not as common, is the strictures. Okay, right down the urethra here, we're not able to pass urine as a result of those strictures. That gets us into this infection of the bladder wall. Now, what if we also have a stone that is sitting right down here on our urethra? And we realize that maybe you have a nephrolithiasis. Now, if we are not able to pass urine through the ureter, that makes stasis and therefore leading to these infections and more tied up to the complicated urinary tract infection. Another aspect is if you are late in pregnancy, you just um, have a pregnant or a gravid woman late in pregnancy and they're compressing against the ureter right there. That is going to cause stasis and can tip us into the complicated urinary tract infection. Now, the functional bit is if we have a dysfunction right here. Now, top on the list here, we could be having what's called a neurogenic bladder. This is common. This is very common and it can be brought about by drugs. Number two, it can also be brought about by diabetes mellitus. And the aspect is the urinary bladder is not able to contract, leading to the injection or the release of that particular urine. Another aspect that is very common in children is the urethral reflux. We call it VUR, very common in children. Another aspect is early mid pregnancy. Early mid pregnancy, here we'll be speaking about the effect of progesterone that makes these particular tubes or the ureters not being able to contract and releasing or facilitating the flow of urine. Now, the other aspects that will also lead us into the complicated urinary tract infection is instrumentation. Here, we will be speaking about when we have instrumentations, whether it's a urologic procedure or, and the most common one here when we speak about instrumentation is the Foley catheter. The Foley catheter is the most common implicator. This one leads to what's called a CAUTI. CAUTI is catheter associated urinary tract infection. Another aspect is when we have a nephrostomy tube or a urethral stent. Either way, when we simply have any urologic procedure. Another aspect that tips us into complicated urinary tract infection. What if we have these bags and our polymorphonuclear neutrophils, our lymphocytes, in one way or the other, in some form or way, are not able to fight these infections? That happens in immunosuppressed states. An example is when there is diabetes and when there is HIV or AIDS. If that happens, ideally we are supposed to kill the bacteria, but there is reduced ability to kill this bacteria, and that tips us into what's called complicated urinary tract infection. Now, in that aspect, now that we've already highlighted, when it comes to complicated urinary tract infections, we'll be speaking about a healthy female, non-pregnant, non-immunosuppressed. Okay, but then there is an added bit of uncomplicated urinary tract infection, that ideally we will be lacking signs of systemic inflammation. Okay, that's the newer version of uncomplicated urinary tract infections. But for complicated urinary tract infections, we will be talking about all the risk factors that we talked about. And first here is male. Okay, a male maybe that has benign prostate hypertrophy, strictures, anephrolysis, and things like that. Pregnancy. Okay, we have either a late pregnancy or an early